Gangrene. Gangrene, it is a necrosis of tissue associated with the superadded purification, most often followed by the coagulated necrosis due to the type of gangrene. Dry gangrene, wheat gangrene, gas gangrene. It is various of wheat gangrene, diagangrene. This type of gangrene mainly develop in the ischemic tissue of the coagulative necrosis. Dry gangrene is usually seen due to peripheral arterial disease leading to acute or chronic limb ischemia. The typical dry gangrene is the toes feet of an old patient due to severe atherosclerosis. It can also be seen in patients with a history of chronic smoking, uncontrolled diabetic mellitus, high cholesterol level, renal disease, etc. It is usually initiated in one of the toes, which is farthest from the blood supply of that particular tissue or part of body. The dry gangrene usually spreads slowly into the ischemia area, line of separation. It is formed at this point between the gangrenous part of the viable part. Grossly, the affected part appear dry, slaughter and dark black. It is black due to liberation of hemoglobin from the hemolytic RBC, which react the hydrogen disulfide and result in formation of black iron sulfate. The line of separation usually bring around the complete separation of affected tissue, and it is may eventually fall off is no removal surgically, spontaneous amputation. Over the period of time, the dry gangrene may further develop into wheat gangrene. It is an infection developed in this dead tissue. Wheat gangrene. Wheat gangrene is characterized by presence of sepsis result from the free communication between the infected fluid and coagulative fluid. Wheat gangrene usually develop rapidly due to the blockage of vessel leading the saturation of blood, which promote rapid growth of bacteria. The affected part appear oedematous, soft, purified, rotten and dark. It usually occurs in naturally moist tissue of the body where the affected part for the rapid growth of purificative bacteria. It can be seen in various parts of the body like bowel, mouth, cervix, lungs, etc. The classical example of wheat gangrene of the bowel, it is commonly seen in the strangulation area and volvulus. Appearance of coagulation necrosis, ulcerated and sluggish mucosa. It is also presence of acute inflammatory exudate and thrombosed vessel. The diabetic foot is also one of the common examples where the high glucose content in necrosed tissue favor growth of bacteria. It can also be seen in the bed sore due to presence of site like sacrum, buckets, etc. The spreading wheat gangrene generally lack properly. Separation through the systemic circulation. It may even spread to the peritoneal cavity. Therefore, due to the high mortality association with the infection, wheat gangrene usually emergency amputation of the limb or laparotomy is often needed as per the situation to limit the systemic infection. Dry gangrene, wheat gangrene. Site commonly limb, wheat gangrene, more commonly in bowel. Occurrence, dry gangrene, external tissue, wheat gangrene, internal tissue. Pathogenesis, dry gangrene, secondary due to ischemia, usually urethral occlusion, wheat gangrene. Primary, secondary cause, blockage of both various drainage and neutral obstruction. Microscopy, dry gangrene, part is usually by shrunken black. Wheat gangrene, affected parts usually most soft, swollen and rotten dark. Purification, dry gangrene, it is limited and swollen. Wheat gangrene, it is markedly extensive, rapid. Example, line of dry gangrene present with gangrene absent. Bacterial growth. Bacteria usually fail to survive. Rapid growth. Local temperature. Comparative warm. Comparatively cold. Spread slow. Rapid. Toxemia. Mild. Severe. Definition. Dry gangrene. It is type of gangrene which is developed mainly due to bacterial obstruction and produce sharply localized dryness of the dead tissue. Wheat gangrene. It is type of gangrene usually association with the bacterial infection in the affected tissue. Treatment. Dry gangrene. Usually the affected part is amputated. Wheat gangrene. Usually they require emergency laparotomy affected limb amputation to avoid the septicemia. Mortality comparatively less in dry gangrene. Wheat gangrene comparatively more. Prognosis is comparatively better due to little septicemia. Wheat gangrene prognosis is comparatively poor due to profound toxemia. Gas gangrene. It is highly fatal spreading infection caused by the clostridial organism Clostridia perfringens, which result in necrosis. It is special form of wheat gangrene, which is the Clostridium organism gain entry into the tissue through open contaminated wound. Etiology. Clostridium perfringens. Clostridium septicum. High risk group. Patient with lower limb amputation. High velocity gain short wound with proliferation of hollow vessel. Road traffic accident RTA. Pathogenesis. Injury. Road traffic accident. Soil foreign body Clostridium organism. Spread anaerobic cellulitis. Breakdown of muscle collagen. Change in the color of muscles. Change in the color of muscle is suggested of dull red ischemia, green necrosis, black gangrene. Multiplication of the pathogenic organism. Production of gas by the infective organism NH2, NH3 etc. Extensive edema. Gangrene of the affected limb muscle spreading systemic ischemia. Morphological feature. Closely the affected area is swollen, painful, along accumulation of gas bubble within affected tissue. Further, the affected tissue become dark, black, fluid smell. Microscopically, the muscle fiber undergo cognitive necrosis along with the liquefative, numb and organism in the present in affected part. Clinical feature. Severe pain with gross edema of often part. Color change in affected muscle. Change in color of overlay skin. Rapid increase in the pulse rate. Hypotension, septic shock. Diagnosis. It is above mentioned clinical picture of the patient along with the culture sensitivity of the pus. The blood culture and pus culture help to confirm the presence of Clostridium organism. Treatment. Emergency surgery may include excision on all the dead muscle and necrotic tissue. Use of blood spectrum antibiotic like crystalline penicillin should be used. Use of polyvalent antigen gangrene serum. Amputation should be taken into consideration of proved to be life-saving measure in the patient.